There are supplements that can potently increase testosterone and free testosterone production. Tongkat Ali and Fadogia agrestis, talking about testosterone and free testosterone and luteinizing hormone. Luteinizing hormone is released from the pituitary, which is this gland not far from the roof of your mouth, and its nearby neighbor, the hypothalamus, is a collection of neurons that sits above the roof of your mouth and talks to the pituitary, talks to it through neural connections and hormone-based connections. There is a hormone called GnRH, gonadotropin-releasing hormone, that is released from the hypothalamus into the pituitary. It stimulates the release of luteinizing hormone, or LH, which then travels in the bloodstream to impact multiple tissues in the body, but mainly the ovary in females and the testes in males, to stimulate estrogen production and testosterone production. There are supplements that can potently increase GnRH and or luteinizing hormone and then indirectly increase testosterone and estrogen. And I always like to remind people testosterone and estrogen are present in both males and females. Okay? And both are important for things like libido, muscle growth, and so on. A lot of people think that, in males, having very high testosterone and low estrogen is actually ideal. It's actually not ideal if you want to keep your libido. Anything that lowers your estrogen too far is going to reduce your libido. You don't want estrogen too high, but you also do not want it too low. So supplements that can tickle this pathway, or actually can act as a bit more of a directed hammer on this luteinizing hormone pathway, may also impact GnRH, are things like Fadogia agrestis. This is an herb that I've talked about before on the podcast, that when taken at dosages of 600 milligrams per day, many people, not all, report elevated levels of libido, elevated sperm production, elevated testosterone, in some cases elevated estrogen, a bunch of hormones downstream of luteinizing hormone. Now, are you going to be a Fadogia agrestis responder or a non-responder? There's simply no way to know except by trying it. If you are going to go down this route, there are two very important considerations. First of all, there's a fairly extensive literature on the fact that Fadogia agrestis can be toxic to testicular cells and perhaps other cells when taken at very high dosages. So obeying the particular dosages of Fadogia agrestis that are recommended on various product labels and cycling Fadogia agrestis can be important. Some people need to cycle it 8 weeks on, 2 weeks off. Other people opt for 12 weeks on, a month off. I know a few people who have taken it continuously with no issues, but I do want to suggest caution when taking Fadogia agrestis. The cautionary notes are stay within the recommended dosage ranges. You can go lower, but certainly don't go higher. And I think it is wise to cycle every 8 weeks or so to come off it for 2 weeks and then going back on if that's your choice, if you feel it benefited you, or taking it for 12-week periods of time and then cycling off for a full month before repeating again. The best way to know whether or not Fadogia or any of these other supplements is impacting your hormone levels in the direction that you want and not impacting your hormone levels or other aspects of your biology in ways that you don't want is from a blood test. There is simply no better tool to evaluate whether or not these supplements are working to support your hormones in the ways that you want and not causing issues, except to take a blood test. Blood tests are going to be very important. I recommend taking them before adding in any supplement to increase hormones of any kind or decrease hormones of any kind for that matter. And then again, after about 4 to 8 weeks of taking that particular supplement in order to evaluate whether or not it worked and whether or not it had any negative effects that you would like to avoid. I also want to remind people of the dosage conversation that we had earlier. Just because there's a recommended dosage of Fadogia agrestis of say 600 milligrams per day, first of all, that is not an invitation to take twice as much and expect twice the positive effects. That is not a good approach, especially with something like Fadogia agrestis, which can, at high dosages, be toxic. But it's also important to perhaps consider taking a lower dosage and seeing how that affects your hormones. That approach requires a bit more patience. I know most people are thinking, I want the effect and I want it now. But I think it's very important when thinking about exercise or nutrition or supplementation to really play the long game, to think about what's going to work for you in the immediate and in the long term, and to ease into any kind of supplement regimen. For instance, by taking one thing at a time, varying one supplement out and one supplement in, starting at minimal effective dose, and build up your protocols over a year or several years. It really can be beneficial. I can say for myself, I started exploring the supplement space and taking different supplements in different combination and alone, evaluating which ones worked and did not work for me. Some were absolutely dreadful for me. I have tons of stories about supplement fails, some of which were just kind of innocuous, meaning they were a waste of money, which isn't innocuous, but at least it wasn't detrimental to my health. Other supplements, which fortunately don't exist on the market anymore, I think actually were quite dangerous, and I feel lucky that I did not experience even greater negative effects from them. Other supplements have been tremendously useful for me and for other people for things like sleep and hormone support, focus, and so on. So Fadogia agrestis is a good example of a supplement that is known to have potent effects, but you need to approach it with the appropriate, I would say, respect for the fact that the dosage ranges in which it works have to be kept pretty narrow without causing issues. It does increase luteinizing hormone and thereby testosterone and estrogen. So if you're somebody who's already excessively high in one or the other, it's going to be very hard to just direct it to only testosterone or only estrogen, because it is one of the more potent supplements for sake of hormone augmentation, but there are other supplements, in particular Tongkat Ali, which is known to, for instance, increase libido. Whether or not it does that by way of augmenting dopamine-related pathways or testosterone pathways still isn't clear. It is known to increase free testosterone by reducing sex hormone binding globulin. Tongkat Ali can be beneficial both for men and for women in dosages anywhere from 200 milligrams to 600 milligrams per day. So there I would say scale according to body size, although start with the minimum amount and find the minimal effective dose for you. Again, blood work is going to be the most effective way to determine what's working or not working at the level of objective numbers, but subjective experience matters too. If you take it at 400 milligrams for 4 weeks and you don't notice any effect, you might try it at 600 milligrams, but not higher. And if you still don't see an effect, well then doesn't appear to have worked for you. Other people experience dramatic effects from things like Fadogia and Tongkat Ali. Why would that be the case? Well, if you look to the scientific literature, what you find is that the studies that report the biggest effects of any supplement usually start with a population that's somehow diminished or back on its heels in one particular dimension. So for instance, people that are hypogonadal, that are not making enough testosterone or free testosterone. In fact, their levels are very, very low. They're subclinical, off range in terms of the charts, below the normal. Well, those people, when they take supplements like Tongkat Ali, Fadogia, tend to experience greater effects because they're starting from a lower level than people who perhaps are close to the optimal levels achieved through either age, genetics, exercise, nutrition, or some combination of those. So that's an important thing to think about. These are called floor effects and ceiling effects. Ceiling effects are, for instance, if an individual already has very high testosterone and free testosterone and they take a supplement to increase it further, they might not see any increase. Whereas somebody who sits more in the middle to low range stands to experience a much greater increase. In fact, one individual I know who took Tongkat Ali, admittedly on my recommendation, his testosterone was initially very low and he was having a number of different symptoms. He did blood work. That's how he knew it was low. And he then took Tongkat Ali and Fadogia in combination because he decided he just wanted results. He didn't care which thing was going to give him the results. And he experienced big increases in testosterone. This would be not free, but total testosterone. He experienced as much as 600 nanograms per deciliter increase from where he was before, which is very dramatic. It was a near tripling of where his testosterone had started off to where he ended up. I don't know if he's ever done the experiment of removing Fadogia or Tongkat to find out which one it was, and this is why many people just take them in combination. And if you have the budget for it and you are interested in just finding what works, but not isolating what works at the level of single ingredients, that would be the approach I recommend. However, again, I think most people would do well to figure out which specific ingredients are going to work best for them by isolating the variables the way I've described repeatedly throughout this episode. To my knowledge, Tongkat Ali does not need to be cycled, meaning you don't have to take periods of time off from it. I should note that the effects of Tongkat Ali can take a little bit longer to experience, so perhaps blood work should be done 8 to 12 weeks after initiating the Tongkat Ali protocol as opposed to earlier. And it does seem to have sort of cumulative effects on libido, and that points to the likelihood that it's having some impact on neural pathways as opposed to hormone pathways. Hormone pathways can be slow, but in general, neural pathways are the ones that are going to explain slow rising shifts in any kind of physical or mental aspect that then remain stable over time.